We're going to use this cobaltocalcite. Cobaltocalcite is what's in Tums. Next is a carnelian for digestion. We use citrine a lot. Women, I think women today are under a lot of pressure. It's a great stone. I use it in most of my treatments. Minerals have been used in medicine for 5,000 years. And so this is part of the treatment that makes the gemstone facial so great. So now we're going to do the bottoms of your feet. This is to help ground you. This is blue aragonite and black tourmaline. Black tourmaline carries a negative charge. And we're using color therapy as well. Blue and black are part of kidney energy that helps ground you. Okay, are we ready?
Oh, I'm ready.
So the first stage in the gemstone facial is we do cupping. And what I do is I start at the chest. I mean, we do the neck and then we go to the face. We're not gonna be leaving any marks. This is why we use a lot of serum to help the cups glide. This is really sort of the secret area of the body. I have a bias towards, if you're new to this, to please not use glass cups because the neck is a really delicate area. This does not have a draggy motion. I do not want to pull the skin of the neck. It's just too delicate an area. You open your mouth. So we're gonna just step down and close. This is very delicate tissue. And so I'm just kind of going in and giving a gentle squeeze. And then you can pull it out. You know, this isn't a treatment. This is how to build beauty from the inside out. This is a very pretty treatment, but the basis of this treatment is all rooted in traditional Chinese medicine. We get to the gua sha part. Okay, so we're gonna add a little bit more serum. And again, you want to start at the chest. Make sure at all times you are dragging out toward the armpit. You never want to push in because what you're going to do is push lymph into the body and then you're going to puff up. You can see that I'm working at a really, really low angle and I'm sweeping out. So you're going to take the long side of the blade, that's this, and you're just going to gently go up and wiggle in. Yeah, this is not hard, correct? And then you're going to use this groove here. I'm using my finger to hold the skin of the neck. And now this is a move that I really like. This is like a transverse move. So what I like people to do is remember, secure your neck, take this nice small end of the blade and then go into the back of the neck. This is actually ironing out these folds that you're creating during the day. We're gonna move into the face, and I think we have a clencher here. As we go over the masseter, that's this big muscle right here. If you're hitting almost like a stop or a bump in the road, you can actually take the little bunny ear right here and give yourself a tiny massage. Really be gentle and kind to your eyes. And remember, you're going almost at a flat angle, like maybe 0 to 5. You're using more of a gentle pressure of the entire tool to pull the lymph out. So when you wash out your forehead, you're gonna go a little bit into your hairline. You have a lot of tension in your forehead and the muscles of the forehead start back in the hairline. So we're gonna needle inside the hairline to loosen that forehead up. You really don't need a lot. Your skin is perfect. Where we're really addressing on you is the sides of your face and the top of the forehead because of the tension. And also in your eye area because of your eye strain. And then we do have needles here for your clenching. You should be feeling like a really cool tuggy sensation in your forehead. Are you feeling like the pull?
A little bit, yeah.
Inhale, exhale, good job. Inhale, exhale, good job. So here comes the gems. Obviously, these are energy centers of the body.
Why these specific gemstones?
You know, in Chinese medicine, our face is broken up into zones. The cheeks are the digestion. On your forehead, it's purple and clear. This represents yin tang, which is this point right here. It's a very good point for focus and concentration. Blue stones here to kind of quell hormonal acne. You don't have any, your skin's really beautiful. But a lot of times that's what happens. Anyway, we're gonna let you rest. Oh, that's excellent. A lot of people fall asleep during this process. So we're gonna actually start taking your crystals off and then we'll pull the needles. I'm using an aromatherapy to awaken the skin. And we're gonna do just a tiny bit of gua sha on you. And this is a probiotic cream. It smells so good.
Oh, it does smell really good.
Doesn't it smell amazing? You've had ear seeds before, yes? If they bother you, take them out. We're putting these points on to balance your system. I know that you've got some
How do they stick on?
There's a medical adhesive, it's clear. And so if you're feeling stressed, you can give yourself like a little squeeze. Some people want a picture, you know, that Instagram shot is what people, I think, brings people in, but you can't deny the studies that have been done on Chinese medicine and skin.
Hello there, my name is Maria. Nice to meet you. I am a nurse practitioner here, and I was asked to examine you today, and I will be taking care of you. Let's start from the very beginning. I need your first and last name. Okay, Gregory. Your last name? Alexander. Very good. I need your date of birth. Okay, very good. Any allergies? Are you diabetic? Any history of mental illnesses in the family? No? Very good. Alright, I see they already took your height and your weight. That's good. Let me just fill out a couple more things here. We have your insurance information. You signed our HIPAA form. Everything seems to be fine. So, let me start from the very basics. First of all, let me see, where are you injured? They told me it's the leg, right? I need you to raise up your pants. Yeah. Okay. Well, no blood there, so we'll come back to that. Let me just take your blood pressure. Okay. Alright, I need you to relax your hand. Okay. Very good. Just a moment. Your blood pressure's great, so you're doing so good. Let me listen to your lungs and and your heart now. Okay, I need you to breathe. Take a deep breath. One more time. You're doing so good. Good job. Okay, now I need you not to breathe for a second. Come on. Okay. Alright, I need you to cough for me one time. Come on. Very good. Now let me do it from the back. Okay, breathe. Deep breath. One more time. Very good. Now don't breathe. Very good. Okay, thank you. You're doing just perfect. Nothing in the lungs. I don't hear anything bad. Let me see. Let me look at your eyes. Look in my eyes, please. Okay, very good. Let me look at your ears. This one's look good. This one's fine too. Very good. You're such a good kid. Open your mouth. Say ah. Alright, perfect. You're a healthy, very healthy young boy. Okay. So let me treat your wound a little here. Okay? You might feel a bit of burning, but it will go away, I promise. Okay. You ready? I will blow on it all. Come on. It's not so bad, is it? See? And we're all done. You see? We cleaned irritation there. Let me put a band-aid over it. See? We're all done with it. Now I do have x-ray. Let me see. I don't actually see any fractures. Nope. Nothing here. That's very good. Now I'm gonna touch your leg. I'm gonna press on some parts and you need to tell me if it hurts or not. Okay. Does it hurt when I touch here? No. Good. Here? What about here? Well, just like I thought. Okay, now I do see some of the swelling. It will go away with time, obviously, but you do need to be very careful. How did it happen to you? Somebody helped you? Or you did it all by yourself? Skateboarding. That's very good for you. It's good that you do sports, but you have to remember that you need to do a lot of exercising to stand on your legs properly. Okay, not to fall. Don't forget to wear protective pads and helmet, please. Okay, you promise me? Very good. I'm happy about it. So let me write you a prescription. I'm gonna prescribe a cyclobenzaprine for you. It's this pills right here. I will need you to take it every 6 hours, 1 tablet every 6 hours, with plenty of water. Maybe a cup, maybe even more cup than a cup. Okay, but if you don't want to take these, you can take any over-the-counter painkillers. It will help just as much, pretty much. And the second thing I will recommend you is the BioFreeze Pain Relieving Gel. It is one of the best ones. There it is. And I always recommend it to everybody because I'll let you smell it. It's smelling. It's very minty. It has this well, gel type of a texture. What it does, it will warm up your muscle and the swelling will go away with time. So that might help you with the swelling. Plus it does, it makes a great cooling effect too. And then it burns a little bit. It might burn a little bit. It will, you know, it will go away with time. It will feel pleasant after that. Now I do recommend you to stay away from sports for a couple of weeks for me. And try to relax and enjoy. Alright, we're good to go. Here's your prescription. You take care. Bye.